Preview. Preview. Preview.
Welcome to an interesting episode of Off the Cuff, the series that keeps GPs up to date about the important issues in blood pressure monitoring today. In this program, we'll be looking at the different types of devices that can be used to measure blood pressure in the surgery. And in particular, what are the potential alternatives to the traditional mercury sphygmomanometer? The first question is, why do we need an alternative? The dangers of using mercury in the healthcare setting are now widely known, and it is acknowledged that the mercury in the familiar mercury sphygmomanometers poses a potential health and safety risk. A policy paper issued by the World Health Organization in August 2005 showed that mercury-containing healthcare equipment will invariably break at some time. This leads to such thorny issues as, what happens if the gauge of a mercury sphygmomanometer breaks and there is a mercury spill? And how should old machines be disposed of safely? These concerns have led to investigations into potential alternatives. Advances in technology mean it may be time to leave the old favourite behind. But do the newer machines provide the accuracy needed? What are the pros and cons of the different machines available? And what should you consider if looking for a replacement machine? In this program, we will talk to selected machine manufacturers to find out some of the features of the newer blood pressure measuring devices. But first, Professor Stephen Harrop, President of the High Blood Pressure Research Council of Australia and Head of the Department of Physiology at the University of Melbourne, offers his expert advice.
As doctors, we've been used to measuring blood pressure with the time-honoured method of a mercury sphygmomanometer and our stethoscopes. But times are changing and we need to re-evaluate the methods by which we measure blood pressure, and we'll be discussing today some of the three more modern methods that provide alternatives to the mercury machine. The reason that we're concerned about mercury is twofold. Firstly, it's a toxin, and there are environmental hazards that have caused countries in Europe, for example, to start banning the use of mercury machines in the healthcare setting. The second is that the mercury measurement relies on our skills as observers, which under certain circumstances can be difficult to obtain accurate recordings with a stethoscope while listening to the pulse and watching the falling column of mercury and undoing the bladder at a certain rate.
As we've heard, electronic and hybrid machines offer an alternative to the mercury sphygmomanometer, as long as they are validated to meet international standards. But how do these machines compare in the real-life setting of the GP surgery? And how do the Android and electronic devices fare in terms of reliability and usability? We put these questions to GPs to find out what they really think about blood pressure devices.
I was pleasantly surprised that it had advantages that I wasn't expecting. I wasn't expecting that I'd have a little bit of extra time to do something while the machine was automatically taking the blood pressure, and I was suddenly able to give my patients my full attention while their blood pressure was being taken. And if they're anxious, and it seems to be that almost everybody is at least a little bit anxious, either coming into the surgery or knowing they're being measured, and I can bring their blood pressure down either by distracting them or by doing a mini relaxation exercise with them.
So now that we know a little more about the different options for blood pressure monitors, what about the devices themselves? We spoke to some machine manufacturers to find out exactly what they offer.
Our purpose with digitals is basically to try and change the way people are thinking in regards to the mercury, aneroid and digital debate. We feel that digitals are the future of blood pressure monitoring and provide just as accurate a reading as a doctor's method or other forms of method that are used. And there's evidence of this both with our model and other brands on the market. And the key aspect with digital blood pressure monitors is that they have to be validated.
So there are alternatives. And while the future of blood pressure monitoring technology looks promising, current electronic devices have been shown to provide reliable and accurate measures of blood pressure for your patients today. Thanks for watching this episode of Off the Cuff.